As nearly 85% of eligible Ontarians are now fully vaccinated, more employers are expecting their staff to show that they've had the jab. And while a new app might make doing so easier, this may be more complicated than it seems. With us on Why, in Port Loring, Ontario, in the district of Parry Sound, there's Sharleen Stewart. She's the president of the SEIU Healthcare Union. In the downtown core, Ryan Watkins, employment lawyer and partner at Whitten Lublin. And in midtown of the provincial capital, Julie Kwiecinski. She's Director of Provincial Affairs for the Ontario branch of the CFIB. That's the Canadian Federation of Independent Business. And it's great to have you three with us here on TVO tonight. Ryan, can we just do a couple of definitions here? Because we hear these terms used interchangeably, and I want to make sure we're all on the same page. Vaccine mandates, vaccine passports. Is there a difference between these two things?
So a mandate traditionally is set by an employer stating that you have to be vaccinated to work for an employer. When we're talking about passports, typically we're talking about businesses where there has been now we have the government has come out with a QR code where to go into an establishment, you have to scan your code. So, like a traditional passport, when you go to the airport, you have to show your passport to get on the flight. That's what we're talking about in terms of vaccines.
Gotcha. Okay, Sharleen, let me get you in here now, because we are starting to see, I think, more and more employers say that if you don't get vaccinated, you may not have a job. I mean, the Toronto Transit Commission, the TTC, suggested the other day that their members have got to get vaccinated or they're fired. How concerned are you about your members being fired if they don't get the jab?
Well, Steve, of course, we're concerned about workers for any reason not being at the workplace. Being fired, of course, is going to put an added stress on the workplace. We don't want to see any healthcare workers, obviously, get ill or die from this virus. We already lost 5 members, so definitely we support the vaccine mandates. It's about workplace safety. It's about knowing that you're protected and knowing that the person you're working shoulder to shoulder with is protecting you. But again, we do obviously have a staffing crisis that we talked about many times on your show. So the vaccine is adding to that crisis. But I have to tell you, Steve, it is not the only reason why workers are leaving the workforce and the sector. So absolutely, we're concerned about them not being at work and for whatever reason terminated or what is it? It's leave without pay. We need those workers to be at the workplace, and we need to find solutions for all of it, not just the vaccine.
No, I appreciate that, and you're quite right. We have had many discussions on this program about the difficulties that the people who do the jobs of some of the hardest jobs in society, we want to make sure they're on the job. But do you believe it is a reasonable response for an employer to say, particularly in healthcare, you must be vaccinated or you're out?
It's all about keeping people safe, and absolutely we support keeping the workers safe and healthy and, quite frankly, alive, and the people that they care for. SEIU has supported mandatory vaccinations. Our members, close to 80%, do, and they look at it, as I said, as a issue of workplace safety, protecting themselves, their co-workers, and the people that they care for.
Okay. Julie, how do small businesses that you represent feel about a vaccine mandate?
Well, we surveyed them in August, and it was split. 54% are in favor of vaccinations of employees in the workplace, 34% are against, and 12% are undecided. So the challenges are very different for a small business than a larger business. If the government doesn't make this law, and we're not suggesting that they do, the vulnerabilities for human rights and legal complaints are higher for small businesses, although the Human Rights Commission did come up with a web post on September 22nd saying that you didn't have to accommodate individuals if they choose not to be vaccinated for personal reasons. However, I go back to my earlier point. If the government isn't making it law, small businesses are vulnerable to potential human rights and legal challenges, and they do have challenges with accommodating employees. It's easy for a large business to find accommodations for employees when they have hundreds or thousands of employees, but for a small business that has 3 to 5 employees to begin with, how do you make accommodations that are actually allowable?
Well, let me follow up with you as well. And I'm glad you put that Ontario Human Rights Commission statement on the record there, because yes, the commission said you don't have a right to a job if you don't want to get vaccinated. And if they fire you, I mean, essentially they were saying, don't come to us. So in your view, do you believe that employers ought to be allowed to fire employees who refuse to get vaccinated?
I don't know if I'd go that far, Steve. As I said, we're a grassroots organizations, and we take our cues from our members. And as I said before, we're very split on this issue. It's extremely divisive. 54% are in favor of employees getting vaccinated in the workplace, 34% against, 12% undecided. That's a majority. It's not a clear majority. So again, I go back to the fact that there are different challenges. Already we're facing a labor shortage, and that is exacerbated if you are a business that only has 3 to 5 employees to begin with. So I can't go that far to say that, Steve, because we don't have the member data to support that.
Well, Ryan, let me get you in here then. Do you believe it is legal for employers to fire employees if they don't get vaccinated?
I think that they can. I think when we start with the premise that an employer's job is to keep workers safe, having a policy where their employees have to get vaccinated certainly makes sense. Now, the caveat, which we've already discussed, is that if there's a human rights concern, and the only two so far that have been credible in the eyes of the law, are if there is a medical exemption, which has been limited, and also a religious exemption. Again, with religion, it's been limited as well. You haven't seen many cases that have been able to make it through the court system successfully. And with that, if an employer does let an employee go, they are entitled to severance. So I don't believe that an employer can let an employee go because they are not vaccinated and not pay them any severance.
Ryan, do you think employees are somewhat in the driver's seat here, particularly in the service sector, in as much as we're hearing there's a tremendous shortage of people to work in that sector right now, and if they don't want to get vaccinated, maybe that's something employers are just going to have to put up with?
Well, you're right. It's sector by sector, and certainly in the service sector, it looks to be that employees have the upper hand. But at the same time, employers have to be mindful of what's going to keep the workers that are there and who are vaccinated. What's going to keep them safe? And so that's why we see more and more businesses implementing mandatory vaccination policies.
Sharleen, I wonder if you could help me understand, because I think you said earlier 80% of your members have been vaccinated, which is great, but 20%, have I got that right? It was 80%? Is that the number you said?
No, actually, we polled our members to see where they're feeling on the mandatory vaccination in the workplace, and almost 80% supported it. There's almost 96% of frontline workers vaccinated right now.
Okay.
And that number is, increasing as the mandate deadlines come to be.
Well, 96, even better. But could you maybe help us get inside the heads of the 4% who work in healthcare, who work in long-term care settings perhaps, who therefore potentially have more exposure to COVID-19 than the average person, and who potentially could expose older people who are the most vulnerable to COVID-19 and dying from it? Why would that person not want to get vaccinated under those circumstances?
You know, Steve, there's so many reasons, obviously, that they have the hesitancy. Some of them in their minds are very legitimate. And I've had so many conversations where they've been balancing their fear or their beliefs why not to get vaccinated. They take a look at the other side of the table, what's being offered to them if they do take the vaccine. And some of them are terrified to do it, but they take a look at the working conditions again and some of the respect and protection that they're receiving from their employer, and they're not seeing it worth it. I mean, we're down to about a 4 to 6%, and we continue because, as we said, the staffing crisis, we want them to be at work. They're not lined up at the doors to take these jobs. But again, it's not just about the vaccine hesitancy. It's, I refer to it as an iceberg. It's you see what's above the water, but there's so much below that is also a part of the reason for not taking the vaccine.
Okay, let me do one quick follow-up with you on this, though, because we did have a guest on this program a couple of weeks ago, one of whose parents died in long-term care from COVID-19, and that parent caught COVID-19 from a PSW. So, in your view, are there any circumstances where it's acceptable for a PSW not to be vaccinated?
No. Again, there are ways in which you are exempt, and that is, like Ryan said, for medical exemptions. These workers do understand clearly the consequences of not getting vaccinated, and they are choosing to leave the job, to either be terminated or go on unpaid leave of absence. So it's clear. Again, we do not want one more member or one more senior to die because of this virus. And I agree. If you're not vaccinated and you do not get the exemption, then the consequences are that you don't work in the workplace. Now, they need every fair representation. Like we said, severance. Is there accommodations that can be done? Have they been, adequately educated, had every opportunity to make that decision, understand clearly the consequences? And, in many cases, that's been done. We will absolutely have members lose their job because they did not get vaccinated. That's unfortunate, but we know the consequences and we want everybody to stay safe.
Well, that last answer actually prompted another question from me, because you said all of your members, of course, deserve representation. But if one of your members went to the Human Rights Commission saying, I don't want to get the jab for whatever reason, and they didn't have a medical or a religious exemption, would you, as their union leader, feel obliged to help represent them to make that case to the commission?
We've been clear with the frontline workers that likely any challenges to this is not going to be successful. Of course, we are representing them on a one-on-one basis, one circumstance issue at a time. So we've been very clear to them that it's a mandate. It's clear the consequences. We encourage them to get vaccinated. If they choose not to, then there is very little that they can do about that. They're making this decision, hopefully, with eyes wide open, and they've had every bit of information put before them.
Gotcha. Okay, let's play some tape here. Or I guess it's not really tape. We're not on videotape anymore. We'll roll the server, and we'll get this digital clip to play. That's what I meant to say. Here's Premier Ford last Friday about mandatory vaccine policies in the healthcare sector. Sheldon, if you would.
Here in Ontario, many hospitals have implemented mandatory vaccine policies, as our government has maintained flexibility for health leaders to do so if appropriate. While some have called for province-wide mandate, any decision to do so needs to be weighed against the real risk of staff shortages that could compromise care. According to recent estimates, 15% of our health system workforce remains unvaccinated, putting the magnitude of potential staff losses in the tens of thousands.
Okay, Julie, you've heard the conundrum that the provincial government is wrestling with on this issue. Do you think they've made the right call here?
Well, I think representing small businesses, the point that I want to raise is the fact that small businesses are shouldered with the responsibility of verifying vaccine credentials already, without any help from the government for example, funding for smart devices, funding for extra staff, funding for lost business. That's a very important point. And last Friday, the government announced that the large businesses like sporting venues would be allowed to cram thousands of people into an arena without physical distancing requirements, yet gyms, restaurants, bars, bowling alleys are limited to certain capacity restrictions, and this is really taking away their ability to generate revenue for months and months of lost business. For example, restaurants in Toronto were closed to indoor dining for 411 days. And what I'm representing now in terms of small business is pushing the Ontario government to immediately level the playing field between big businesses like large sports venues and small businesses like gyms and restaurants. Why is it fair
Julie, hang on a
for a
sec.
big
I'm
business?
just going to jump in here because I actually want to get to that. We are going to get to that, but you've jumped ahead on me a little bit here, and I'd really like you to just sort of focus on the question at hand, which is, if you're running a small business, as you pointed out, you are responsible for ensuring that the people who come into that business are appropriately vaccinated. Should small businesses not have the responsibility to do that? Is that your view?
My view is this, and again, CFIB, I stands for independent. It's up to each individual business right now if they choose to put in place a vaccination policy for their employees. It's not mandatory, it's not law by government, unlike the vaccine credentials program, which is law. So it's entirely up to them. And I go back to an earlier point. The fact that it isn't law, and I'm not saying it should be, exposes small businesses to potential human rights and legal challenges, because a person can't say, hey, the government made me do this as a small business owner, sue the government if you don't like it. They are exposed. And it is my job as a representative of small business to make sure that any business owner gets the advice that if they choose to put in place a vaccination policy of their employees, that they should consult a lawyer first. We don't want to see any businesses faced with challenges. And yes, the business would likely win the challenge, but we don't want them to go under in legal fees before that result would actually come to fruition. So again, this is an extremely touchy issue amongst our membership. They are split on it, and it would be inappropriate of me to suggest otherwise. That 54% is a majority, but it is certainly not an overwhelming majority. And I have to represent all our members in television programs like this one.
No, I get you. And you just suggested that if in doubt, consult a lawyer. So that's what I'm going to do right now. Thankfully, we have Ryan here to consult on this issue. Ryan, this is a conundrum. What's the way out of it?
Well, this is the difficulty here. If the government does not mandate vaccination policies across businesses, then it is up to the businesses to decide. And then we have a cross mix of different various businesses doing, some requiring vaccinations, others don't. And what happens is the public doesn't know, who to trust, what business to go to. So, therefore, we need a policy across the board where it's not up to the individual employer, but rather, the government has mandated that vaccinations be required across businesses. That way, the government is on the hook for any issues, and it alleviates some concerns for small businesses.
Do you see the government prepared to take that step at the moment?
I don't see them prepared to take that step at all. I think that's why we've seen Premier Ford in a consultation, at least in terms of healthcare, to kind of put the onus on healthcare organizations to come up with a solution. So I don't see it happening anytime soon.
Okay, Sharleen, let me ask you about healthcare in this circumstance because, and I'm going to hearken back to an example from a couple of weeks ago when the CEO of Hamilton Health Sciences, which is essentially the corporation that runs all the hospitals in Hamilton, he did a town hall, a virtual town hall, and he said to all the people who obviously all work in healthcare, he said to them all, if you're having any concerns about getting vaccinated and you still want to show up for work, get over yourself. You have to. Period, full stop. Would you sign on to that?
Well, again, I echo what's been said. It's just been sort of piecemeal, the mandate that's coming out, which has caused massive confusion among all sectors. And speaking about healthcare, you've got this CEO who took that stand. You've got others who are a lot more lenient, and then across sector, again, I'm going to go back to the staffing crisis. You've got this mandate now in long-term care where it says by November 15th, you're vaccinated or you're terminated. Those workers can still work in other sectors of the healthcare system. So, whatever the Premier is going to do on vaccine mandates in all sectors, he has to make it universal across the board. Smaller businesses are being affected in a negative way. So are smaller healthcare organizations and employers as well. The big ones, they might have the ability to say that because their staffing levels might be a little better, but the smaller ones are struggling. So one universal mandate across the system would help, healthcare would help business and small business.
Based on your knowledge of your members, in a month's time, when that obligation to be vaccinated for long-term care workers comes in, what percentage of workers do you think will simply leave the sector?
There is going to be, I would say right now we're looming around the 4%. Hopefully, that'll be lessened to 2%. But, one person leaving the healthcare sector right now can trigger a crisis in that workplace. So I'm hoping that they'll take the time to, again, consider getting the vaccination. We absolutely encourage them to do that. But hopefully the Premier will mandate staffing levels and full-time jobs the same way he did the vaccine mandate, help the crisis out.
Well, we did see in other provinces, I think we saw in Quebec and British Columbia, that both those governments sort of backed down a little bit, eased off a little bit. Do you think that's the way Ontario should go in order to deal with this situation?
Absolutely. I mean, you take a look at the provinces, which is a really good point. You've got British Columbia. They implemented a universal wages early in the pandemic. Again, they recognized the crisis in healthcare. Quebec recently stopped enforcing wage restraints because they know that that was driving workers away. We're still struggling with Bill 124 here. And just recently, Saskatchewan ended its relationship with Extendicare because the for-profit operator has failed a one time too many. So there are examples across the country. The government could certainly take a look at that and, again, address the staffing crisis. It's really unfortunate, Steve, that 2% of workers don't show up for whatever reason, can throw the whole system into a crisis. This was foreseeable. The vaccine, yes, is affecting the staffing levels, but other issues were the alarm bells were ringing for a couple of years and if not decades on this. So yes, other provinces have addressed it. This government could certainly learn from their examples. Okay,
let me circle back now with Julie because you did want to make the point as you started to earlier. Let's deal with this right now. You're quite right. The Scotiabank Arena somehow allows 20,000 people to come in. They all have to prove they've been vaccinated, but there they are, many of them without masks on. Screaming on for the Leafs. We can leave that aside for now. On the other hand, go to a restaurant, go to a gym, go to a bar. There are still capacity limitations in place. I know you don't like this. Can you talk about what the impact on your members has been of what many are calling a fairly inconsistently approached policy?
Well, this is totally unfair. Like, take a gym, they're limited right now to 50% capacity. It's like chopping a business in half, but their bills are still coming in at 100%. And the issue here, Steve, is leveling the playing field. Why is it okay to allow thousands of fans into the Scotiabank Arena with no physical distancing requirements, yet the rules are different for small businesses when they both have to follow strong health and safety protocols and they both screen for vaccine credentials? Why is the lifting of capacity restrictions fast and furious for big businesses like large sporting venues and slow and cautious for small businesses like gyms, restaurants, bars, bowling alleys, dance studios, and yoga studios? The government needs to level the playing field now. No
doubt, I know that you and or your other members of your organization have talked to, if not the Premier, then certainly senior cabinet ministers about that. And when you put those questions to them, what's the answer you get back?
We get no credible answer. I mean, the Premier's news conference on Friday, he mentioned something about that there was consensus around the table that this sector has strict protocols. So I immediately got tons of phone calls from business owners saying, is the Premier saying that my gym doesn't follow health and safety protocols? Does the Premier not realize that I also screen for vaccine credentials? And the one thing that's really irritating is they're being told now they have to wait for at least 14 days. And it's a very cavalier approach. It's like suggesting that 14 days is nothing, but you have to have walked a COVID mile in a small business owner's shoes. Not just own a business during a pandemic to understand what they're going through. 37% of Ontario's small businesses are at normal revenues right now. The COVID debt right now is $190,000 per small business. And 18% of Ontario small businesses are actively considering bankruptcy. So any day that you deny them more people entry while being unfair and allowing it for big businesses is another missed opportunity for them to start generating revenues that they need in order to survive.
Okay, let me jump in here. Forgive me, Julie, I got to jump in because I got 30 seconds left, and I want to give it to Ryan. Ryan, in your legal judgment, what's the way out of this mess?
Well, that's the difficulty, right? The way out, I believe, is that the government has to mandate mandatory vaccinations. If not, we're going to have a piecemeal approach, and who suffers the most is the consumer and the workers. And so we have to come up with a system where the industry, like the service sector, where we depend on as consumers, they're the ones that are being supported and uplifted. So we got to come up with a better system.
Gotcha. Julie, Ryan, Sharleen, thanks so much for coming on to TVO tonight and sharing your views on this. We're grateful.
Thank you, Steve.
My pleasure.
Thank you.
Stay safe.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.